Have you heard of those letters ADD? Well, really it's ADHD, Attention Deficit Hyperactivity Disorder. I'm Dr. Pete. I'm going to talk to you about ADHD. In particular, it requires a very comprehensive evaluation to make that diagnosis. It should not be just one professional making the diagnosis and also providing treatment. So that comprehensive evaluation includes a clinical interview, a IQ and achievement test, it's a classroom and a teacher observation, it's also rating scales by the teachers and by the parents, and lastly, some objective measure of attention. These are things that neuropsychologists or psychologists can administer to individuals. It should not just be one person doing one checklist about certain behaviors. There are 3 different types of ADHD. There's the inattentive type, which is self-explanatory, individuals who have difficulty concentrating. The hyperactivity and impulsive type, these are individuals that have difficulty sitting in their chair or waiting online. And lastly, the combined type, which includes symptoms from both of those 2 categories. So these are important factors to know that some students might have, and also adults. Adult ADHD is a whole other story because we're not totally sure about it. Some research suggests that individuals actually outgrow ADHD, but at the moment, we are unsure of that. ADHD is 3 times more likely to affect boys when compared to girls. And in terms of affecting some of these behaviors, sugar cannot do it alone. Most of the nutrition and dietary studies find that it's the excitement about that food they might have with sugar, but not the sugar itself. Age of onset is typically around 7, and about 9% of students between the ages of 13 and 18 are diagnosed with ADHD. Now, how do we treat this? When you look at the National Institute of Mental Health, the NIMH, or the Center for Disease and Control, CDC, one of the first lines of defense that they say is medicine. Now, medicine is quite effective in most symptoms of ADHD. However, I think we're doing a disservice if we're not also offering some behavior modification. So in conjunction with the medication, really any individual with this diagnosis should also have received some cognitive and behavioral therapy. So that's ADHD and the whole. I'm Dr. Pete, and thanks for listening.